kick us off?
Sure. Hello, everyone. My name is Jack Lavin, President and CEO of the Chicagoland Chamber of Commerce. Thank you for joining us today for our final webinar of the year, Key Trends and Regulatory Changes to Watch in 2022, presented by our Mid-Market Chicago program. The Chamber's Mid-Market Chicago program is dedicated to providing the programming, networking, and resources that middle market companies across the region need to grow and prosper. We would not be able to do the work we do or host programming like today's webinar without the generous support of our mid-market sponsors. BDO, who's our presenting sponsor for Mid-Market Chicago, BMO Harris Bank, and Aon. Thank you for your continued leadership, support, and investments in Chicago and the Chamber. I also want to thank the Chamber team and especially Amelia Salter, our Senior Director of Programs, for putting today's webinar together and her outstanding work in 2021. We look forward to a lot of great programs in 2022. Also, before we get into today's topic, I just want to remind everyone about the Chamber's job training program. We have a state grant from DCEO to do job training, and the grant covers 50% of your costs. So if you have an interest, please follow up with Amelia or me if you have any interest or questions. It's a great Chamber benefit. I just want to remind all the people on the webinar about that before we get started. As we close out what has certainly been another year full of uncertainty, business leaders continue to face new challenges related to regulatory changes, a shifting corporate climate, and of course, the ongoing pandemic. So in preparation for a new year, we wanted today's program to serve as an overview of the key trends and topics that will impact executive decision-making well into 2022 and beyond. And we have an all-star lineup of speakers with us today to do just that, including a deep dive into what is top of mind for corporate boards, as well as recent banking and healthcare regulatory changes that you should be aware of. We have Lee Sentnor, Professional Practice Director, Corporate Governance at BDO, Pratik Patel, Managing Director, Family Wealth Strategies, BMO Family Office, and Molly Icavoni, Senior Vice President, U.S. Health Solutions for Aon. Thank you each for joining us today to share your perspective and support our Mid-Market Chicago program. I'm excited to have you share your perspectives on these key trends and regulatory changes. Before we kick off today's panel, please allow me to introduce Jason Lipschultz, who is Managing Director, Third Party Attestation with BDO. BDO is instrumental in founding Mid-Market Chicago, so I want to take a moment to thank Jason and his entire team for being such tremendous partners to the Chamber over the years and helping us sustain and grow the program. Thank you for your leadership, Jason. With that, I hand it off to you, Jason.
Thank you, Jack. I appreciate that, and I'll extend the thank you really to Steve Ferrara, who you know well, our Chief Operating Officer, and who really has been one of my main connections to the Chamber. So thank you to Steve, who sends his regards today. And thank you to all of you for joining today, a nice growing audience. Special thank you to all of the speakers for taking their time today right before the holidays to share your insights about what we've seen and what we should be thinking about going into 2022. You'll hear from them in just a moment. As Jack mentioned, Managing Director with BDO and our third-party attestation practice, which sounds like a mouthful, just means we help our clients with security and compliance. And along with that client-serving role, I really have the distinct honor to work directly with the Chamber, along with all of their partners and the presenting the other sponsors today, who you'll be hearing from, BMO Harris and Aon, ultimately working together to help develop programming for Mid-Market Chicago, which was really the first Chicagoland community organization I was introduced to when I joined BDO 3 years ago, and I haven't looked back since. So if you're new to the Chamber, I definitely encourage you to find ways to continue to be involved. We are proud to be the founding and presenting sponsor of Mid-Market Chicago. When we partnered with the Chamber actually back in 2017, so 4 years ago, to first launch the program, we saw an opportunity to develop programming just like this and resources to help support and grow the Chicagoland middle market companies. So really this programming is for you. You're really vital to our regional economy. So this is just one of the many ways that you can get value from the chamber. In terms of today, you're going to hear presentations about 3 areas that are really important to business: governance, banking, and healthcare. We're going to go, just so you know, logistically from one presentation directly to the next, but at the end, we're going to have some time for shared Q&A. So save your questions and be ready to say your question live or say it in the chat, or certainly connect with the speakers afterwards as well. I'm sure they'll be happy to talk to you. So keep that in mind throughout. So with that, we're going to get right into things, and it's my pleasure to introduce to you our first speaker today. Actually, one of my colleagues, Lee Setnor, who is a director within BDO's National Professional Practice within what we call our Center for Corporate Governance. So who better than to talk to us today about governance? And that center is really designed for financial executives and really anyone who is charged with governance of both public and private companies. So she's going to share a little bit about what she's seeing and kick us off with some insights in terms of what's on the top of mind of boards and others charged with governance. So with that, thank you for attending. And Lee, I'm going to turn the floor to you. It's all yours. Thank you.
Thank you so much for having me. I'm honored to be part of this esteemed panel and to be speaking to you today about something that I love to talk about, governance. So with that, Beth, if we want to just jump into that first slide that shows kind of the summary of our board survey, I'll give you a little bit of background on that. So BDO has been offering the board survey for about 8 years. And traditionally, this is an annual survey, but in these dynamic times, we also pivoted to do more of a pulse style survey to get more timely input on a variety of issues that we're all dealing with right now. Our recent survey was conducted by Market Measurement, an independent market research consulting firm on behalf of the corporate governance practice of BDO. If anyone on this call is interested in participating in future surveys, we welcome your participation, so please shoot me a message. In this particular survey, we examined the opinions of 230 corporate directors of public company boards, and the survey went out back in July 2021. The respondents sit on boards across industries, including but not limited to technology, retail, manufacturing, financial services, energy, healthcare, life sciences, real estate, education, and hospitality. So it covers a wide range of industries. And as you can see on the slide, participants' board experience was also noted based on how many concurrent boards they're serving on, director tenure, and the size of the company served, which I think will be of a particular interest to this group. Because as you can see, our respondents are focused in the small and mid-cap space. So the opinions will reflect the concerns in that market, including some potential resource constraints. And you'll notice as we go through the results, ESG garners a great deal of attention right now in this population. So with that, let's get started on the actual results. This slide shows the key takeaways from the survey. Companies continue to face expanding roles and responsibilities, implying all the lessons we're learning over the past 18 months, while continuing to navigate new obstacles. Our survey indicated directors were being challenged by an array of financial, operational, regulatory pressures, as well as a wide range of stakeholder expanded expectations. In addition, companies face new regulatory challenges, issues related to globalization and digital acceleration, the rise of the environmental, social, and governance, or ESG factors being linked to company performance. And while keeping all these challenges top of mind, boards are optimistic in taking active steps forward. This survey explores the evolving corporate strategies for public companies, including how directors plan to oversee the pursuit of growth and increased transparency around these strategic shifts. So we're going to share the full results of this survey with this group following the webinar. So I'm going to spend our very limited time digging into select results in each one of these areas shown on your screen. So speaking of strategic shifts and opportunities, growth via mergers and acquisitions is the top ranked corporate strategy from the survey. And as you can see on this slide, there's been a shift from seeking capital infusions to plans for growth via acquisitions and new revenue streams. Often growth ambitions go hand in hand with workforce expansion. And this year that brings new challenges in this area. 16% of our respondents cited sourcing labor as a top impediment to economic and operational success for the rest of this year. This puts a focus on corporate culture, which is no longer simply a nice to have, but it's a key driver of business and competitive advantage that must remain top of mind for boards and companies when considering the war for talent. So if we want to move on and continue to look at these workforce challenges, recruiting and retaining what is often a business's most valuable asset, its people, has become a challenge and requires a very thoughtful approach these days. These challenges are affecting all levels of hiring, from directors through employees. Labor shortages are abundant, and scrutiny around the composition of the workforce is equally abundant. So this slide shows top strategies reported by directors to mitigate those labor challenges and to attract and retain talent. Now, traditional recruitment and retention, I'm going to stick on that slide for just a couple more minutes and talk about the traditional recruitment and retention efforts. And those continue to center on pay levels and highlighting opportunities for career advancements. But now these compensation packages are composed of more than just salary. Companies poised to win this war for talent strike the right mix of salary, bonuses, and equity awards, in addition to offering competitive benefits, along with flexible and inclusive and supportive work environments. So the war is real, and companies are learning to be flexible in offering prospective employees. Additionally, human capital management is a significant focus for disclosures. There's new SEC guidance applicable for 2021 filings and anticipated additional requirements for broader workforce issues in 2022, which could include metrics such as workforce turnover, skills and development training, compensation, benefits, workforce demographics, and DEI, and health and safety. So not only is all of this happening and evolving, but we're looking for a much greater transparency in this area. I know Molly's going to dive deeper into the healthcare aspects in this area later in the webinar. So now we can move on to the supply chain, our preview. And if any of you are like me, you're no stranger to the supply chain challenges this holiday season. And unfortunately, the ongoing effects of COVID-19 continue to disrupt the supply chains across industries, impacting both productivity and profitability. So supply chain risk includes numerous difficulties that disrupt operations and are not limited to just securing materials and products. Additional risks include increased costs, lost opportunities, and a plethora of third-party risks involving suppliers, including exposure to cyber risk and ESG concerns through those third parties. Some examples of steps being taken to mitigate those supply chain risks include diversifying sourcing first and foremost, and additionally maintaining liquidity, digitizing the supply chain, and improving demand forecasting. So next up, we can't have a conversation about risk without touching on cybersecurity and data protection. They continue to be significant issues for all companies. The top cited oversight challenge for the next 6 months in our survey is ensuring effective cybersecurity and data protection. Ransomware threats in particular are receiving considerable attention, and for very good reason. Recently, BDO hosted a New England director forum where directors were incredibly active in discussing their mitigation for ransomware and sharing examples of ransomware experiences and driving home the need for well-planned and rehearsed responses to these risks. Managing cybersecurity requires layered risk-based approach, and it's critical for boards to take an active role in keeping their organizations prepared both proactively and reactively in this area. In the event of a cyber-related incident, companies need to make sure they have the right skill sets on hand to respond to and remediate the threat. Ultimately, ongoing education, thorough preparation, and continuous monitoring are the best defenses. So next up, we'll talk about reporting and stakeholder engagement. We have a lot to talk about on this slide, and I know Pratik is going to chime in later with the tax area. But as you saw in our initial slide of survey results, coming out of the 2021 proxy season, engagement of shareholders and investors is priority number one. So right now we have two primary factors here. One, there's an increase in stakeholder interest. And two, there's an increase in information to share as a result of the changing environment, and an increase in people interested in hearing that information. So answering the demand for transparency requires consistent, thoughtful communication with stakeholders. And note that I said with stakeholders and not simply at stakeholders. There needs to be thoughtful communication that should be made consistently, but especially as the business makes strategic shifts, explaining those decisions being made, how they benefit the stakeholders, and outlining opportunities for invested parties while also disclosing the associated risks. An investment in this transparency will continue to build trust with stakeholders and ultimately lead to better outcomes for all parties. So with annual reporting season approaching quickly, you can see on this slide that boards anticipate challenges around these increased disclosures and risks. Nearly 3/4 of our directors, or 73% in the survey, say their top short-term ESG priority is keeping up with evolving regulatory guidance to ensure compliance with reporting requirements, which is a lot. 29%, surprisingly, say they're including ESG metrics and disclosures within their audited financial statements. So one example of the evolving regulatory environment is the recently SEC approved NASDAQ comply or disclose proposal, which expects companies to have at least 2 diverse directors, 1 female, 1 underrepresented individual in 2022, and publicly disclose certain diversity statistics. If they do not have 2 diverse directors, listed companies will be required to explain the reasons why they don't. Next, all of this continued economic uncertainty, oh, actually not next slide, just next point on this slide, sorry. It has a direct impact around accounting estimates, including forecasts and fair value estimates. And these already require a high degree of professional judgment and evaluation, but this area is under increased interest and scrutiny from both the SEC and the PCAOB. The SEC has indicated it is seeking more robust fair value measurement disclosures to assist stakeholders in understanding valuation techniques and inputs used, quantitative information about significant unobservable inputs, and the use of third-party pricing services. So that's putting additional pressure on companies from a reporting perspective. Finally, and again, Pratik's gonna, I think, talk more from the tax angle, but while planning for this year's tax provision, companies will need to keep an eye on both domestic and global tax policy changes. So some best practices from a governance perspective in this area include ensuring that tax function has the right resources, that there's a tax control framework in place to foster tax risk, say that a couple times fast, communication mechanisms, and clearly defined processes and controls to identify and manage operational tax risk and provide tax transparency. So that's what I have for you on reporting, and I'm just gonna wrap up here with another slide on the ESG landscape. ESG can be a day-long, probably a week-long presentation in itself. So this is just giving you a high-level overview of what was revealed in the most recent board survey. and how directors are exploring options on how to best comply with these changing requirements and demands to communicate. Companies are remembering, directors are remembering, stakeholders are remembering that the value of ESG initiative extends beyond satisfying the demands. Companies understand that these efforts are good for business and they will contribute to long-term stability and growth. With several ESG priorities marked by directors as near-term priorities, it's clear that boards are taking quick steps in order to ensure their organization's plan align with their future business. So while climate change is in the news and regulations are still under development and comment with the SEC, the Commission did recently release a sample comment letter which highlighted 2010 guidance reminding companies that they have a duty to disclose material information, even if not expressly required by the rules, which will require professional judgment by each company. Many are anticipating that the SEC will soon release official SEC reporting requirement, ESG reporting requirements, and provide some clarity on the array of existing and oftentimes dissimilar frameworks currently available. So ESG is an area where ongoing transparency is especially crucial. Stakeholders have very high expectations, and companies will be required to show not only that they have a plan in place, but prove that they're taking actionable steps supported by qualitative and quantitative disclosures and metrics to make that plan a reality. So I know that there is a lot to think about. I tried to get through that as quickly and as high level as possible. As I mentioned, we'll share the survey at the end of the webinar, and I'm happy to follow up with any questions afterwards as well. Thank you.
Thank you, Lee. That was great. And we're going to shift gears here a little bit, and I wanted to spend some time talking about the pending tax law changes. My name is Pratik Patel. I am an attorney. I work for BMO Family Office, and I head our Family Wealth Strategies group. So what that means is we work within our family office with our 300 largest clients for BMO, the bank. And as in Family Wealth Strategies, we are the planning group for the family office, meaning we are talking to our clients daily about varying planning strategies, whether it's income tax, estate tax, succession planning, and things of that nature. So as you can imagine, we've spent quite a bit of time this year talking about tax law changes. So I wanted to give everyone a quick update on what we are seeing right now. But before I really go into some of the new tax law changes, I actually wanted to provide a little bit of context on where these tax law changes are going. So if we could actually just advance maybe 2 slides. What we are seeing in this landscape, and again, I wanted to provide context. So I want to start with the 1986 Tax Reform Act. This was the Tax Reform Act under Reagan. Prior to this, we hadn't actually seen a significant tax law change until the 1954 Internal Revenue Act. But since that 86 Tax Reform Act, we're seeing 5 tax law changes just on this page, and if you flip the next one, you're going to see 5 more. So we're talking about 10 significant tax law changes over the last 30 or so years, 40 years now, about to be 11 tax law changes. The number of tax law changes in and of itself is less interesting than where they've taken us. So if you flip to the next slide, what you'll see is this is sort of a one data point. The orange bars here represent the high individual tax bracket in a given year. The blue bars represent the low individual tax bracket in a given year. And the dotted red line represents the national deficit. So as you can see, prior to 86, we hadn't seen a number of tax law changes. We hadn't seen the rapid changes that we're seeing right now. And the rates were fairly high. We're seeing 50, 70, if you go back further, even 80 to 90% high-end marginal tax brackets. Since the 80s, since the mid-80s, we're seeing a significant number of tax law changes with sort of a low watermark of, under Reagan, we had a 2-bracket system, 28% being the high bracket, 15% being the low. But we've also seen 10 tax law changes, as we discussed, and most of those have actually inched the tax brackets upwards. Even that sort of that dip between 2003 and 2014 is a bit misleading because that came with the PEAS Act, which limited some of our itemized deductions and actually increased tax revenue. The Tax Cut and Jobs Act did actually lower tax brackets, but when you take a look at the deficit over this time, and this is 2 years old now, so in 2021, we're at almost $30 trillion in debt. We try and use this as a forward-looking metric on how to plan for where taxes are going in the future. The larger the deficit, the more imbalance we're on a year-to-year basis, the more we're pulling future consumption backwards, meaning at some point in the future, we do anticipate taxes to go up to pay off some of this debt. So if we go to the next slide, and I just want to provide that context because I think we tend to be so reactionary to what we're seeing in the news on a given day. And this cycle has been especially interesting because we've seen a number of different proposals in this legislative cycle. But ultimately, what's come to pass, we think, is going to be far less than what had been proposed. But that doesn't mean we shouldn't really act right now, because some of these opportunities, while they may be still available this year, next year, they might not be available very long in the future. So let's go into some of the business tax law changes that we are seeing. The two big ones we're seeing right now is the first one you may have heard of, or otherwise known as the Amazon tax, the 15% corporate A&T. This is a 15% tax on book income for companies with $1 billion plus in profits. The government is estimating that this would provide an additional $325 billion in tax revenue. We're also seeing a 1% surcharge on corporate stock buybacks. And again, they're seeing another $125 billion in tax revenue from this change. But what's more interesting is what we're not seeing. So if you flip to the next slide, you can see all of what was discussed and ultimately is not going to be, actually it's not a comprehensive list of what was discussed, but it is some of the key big ticket items that were discussed and ultimately not implemented this year. So we're not going to see any corporate tax rate increases. We're going to remain at 21%. We're not seeing any increases in the top individual income tax rate. We're staying at 37%. No increase in capital gains, no changes to the estate and gift tax, meaning no changes to the exemption amount, no changes to the basis, and no changes to the grantor trust rules. So with that, that's a very quick overview of sort of what we're seeing on the business tax law side. But I caution everyone, because we think, we don't know what's going to happen, but next year we are going to have a midterm election. And if the Democrats maintain the majority, you don't know what will change, but this is sort of a glimpse into what was discussed and what we might see in the future. So with that, I know that was very quick, but if anyone has any questions, please let me know. Otherwise, I'm going to pass it over to Molly for a healthcare update.
Thank you, Pratik. It was very helpful in an area that I'm less familiar with. My name is Molly Icavoni. I'm also an attorney, but I'm a legal consultant because I work with non-lawyers at Aon, and I specialize in healthcare law. And one thing I'd like to highlight as we get rolling here is that I call this year the disorganized Affordable Care Act year. It has been literally a tsunami of legislative and regulatory change. So what I am going to do is to take you through basically the big ticket items that you need to be thinking about with respect to your group health plans as a sponsor, and what you need to be coordinating with your health plan administrators, and if carved out, your pharmacy benefit manager, your PBM. We're probably going to need to work with counsel because there are contracting changes that are needed. And then at the end, I have a fairly comprehensive checklist of items you really need to be thinking about, so you can go through and say, oh, did we allow permissive mid-year changes? The plan needs to be amended, that type of thing. I won't go through that in detail, but want you to know that it's there as kind of, I guess, a holiday gift. With that, let's flip the slide. Okay, next slide. All right, so one thing that is a buzzword right now is the word transparency. What is transparency? What does it mean? What do you need to do with respect to group health plan transparency? Really, there were two sets of legislation that focused on transparency. One, believe it or not, was a regulatory in nature under the Trump administration, which implemented the Affordable Care Act transparency provisions. So the ACA actually had a transparency provision that didn't get sort of regulations until late last year. And what that is it really says you need to have machine readable files ready that do not have any login features, so anybody can access them. And originally it was supposed to be ready by January 1st, 2022 for calendar year plan years, but instead the government has given us until July 1st of this year if you have a calendar year plan or a plan year that starts before August 1st. So make sure your health plans are ready to do this. And the machine readable files will not be helpful to plan participants. That is really for the industry to go out and see what things cost, like negotiated rates for in-network providers, historical allowed amounts for out-of-network providers. The prescription drug file has been delayed for now, so continue to monitor. And then in January or in 2023 and 2024, what happens next is there will be this concept that I think people are thinking about, or most Americans think about with transparency. You're going to need to have a tool that allows participants to compare costs among providers. And the first wave will be 500 items and services. And then on or after, for planners beginning on or after 2024, all items and services under your group health plan. Obviously, you as an employer plan sponsor can't do this. So you're going to need to reach out to your health plans to get that ready. Right or wrong, the way the law is written is that you are responsible if you sponsor a self-insured group health plan. If you are insured, let's flip the slide and I'll explain this a bit more. So the way this is going to work is you're going to need to have a contract update, so some sort of amendment. So work with your legal counsel. If you're fully insured, the insurer can be delegated full responsibility, but you still need that contract information. And if you're self-insured, you retain the responsibility, but you can delegate the actual administration of this information. And then maybe you could, have some sort of arrangement, work with your counsel so that your health plan administrator implements this correctly. Next slide. Okay. Keep going. So there's another big law that came through. So what I just discussed was Affordable Care Act transparency. The Affordable Care Act was passed on March 23rd, 2010. Seems like a lifetime ago, but I've been in this role. I've actually been with AN 28 years, so I've lived through it all. Things that came through this year under consolidated appropriations, which was passed over the holidays last year. So I'm really waiting for Build Back Better to ruin my holidays this year. And I know you're not my counselors, but I probably need one. So consolidated appropriations gave us those additional flexibility on FSAs, legislation on surprise medical billing, more price transparency, reporting rules on pharmacy, extension of student loan repayment programs, and mental health parity. I can't discuss all of this today, so we're going to focus on transparency and surprise medical billing. Next slide. All right, so these particular rules, if you are one of the few employers that still maintain grandfathered health plans, it applies to you regardless. It applies to both grandfathered and non-grandfathered group health plans. Next slide. So like I said, there's going to be a price comparison tool under this law as well. So I hope there is nobody here from Congress on the call, but sometimes I worry because what Congress did is they passed provisions that already existed under the Affordable Care Act. So now the agencies, Department of Labor, Treasury, and HHS are tasked with kind of making things fit together. So stay tuned, we'll get more guidance. Next slide. One thing hopefully you're all working on is that your medical ID cards need to have both deductibles and out-of-pocket limits on them under the Consolidated Appropriations Act. Now, thankfully, the agencies came out with a set of frequently asked questions. Because this law was passed less than a year, or just about a year ago, there wasn't enough time to issue comprehensive regulations. So they issued a set of frequently asked questions that kind of delayed everything and said, okay, but everybody operate in good faith starting in 2022. So what they want you to do is at least make sure if you have any new participants that receive new actual cards, You need this information on there for major medical. And then I would say if participants can log in to an internet site and print a card off, make sure that deductible and out-of-pocket max is on there. We do not believe there's anything that requires a reprinting of cards. Always check with counsel, but we really are in a good faith period. That may be required down the road. And then just for pharmacy, just make sure there's eventually a link or something if they have separate deductibles and out-of-pocket maximums. Next slide. Again, the advanced explanation of benefits, I'm not going to spend time here because we have limited time, but basically you'd have to get, participants would be given an EOB in advance of services. The entire industry is going nuts over this. Like, how are we supposed to do that? Then are we going to reconcile? So that has been delayed. Next slide. So don't worry about it yet. Prohibition on gag clauses and price and quality data. You're going to want to talk to your legal counsel because you want to make sure that your contracts do not prevent the sharing of information such as provider-specific cost or quality of care information or data to referring providers. You'll also want to ensure that plans, as long as it's de-identified claims, can share that information. It's important that your contracts are reviewed to ensure there's no gag clauses because the government is going to have you attest in 2022, likely through probably a website with HHS, even if you're DOL Treasury, like a private employer, to say, yes, I confirm that my contracts do not prevent the sharing of certain types of de-identified data. Okay, so just make sure that's on your checklist. That one actually is implemented in good faith if your calendar year plan as of January 1st, 2022. Next slide. Sorry. Okay, accuracy of provider directory information. This is an odd one. And the way this works is if your provider directory for your medical benefits, for example, is even somewhat out of date, and if a participant relies on the provider directory and goes in network, and it turns out that that provider is out of network, the plan must insulate the participant from the additional cost. So you need to make sure those provider directories are current, but more importantly, you need to make sure your health plan administrators are able to administer this complex provision. If a participant comes forward and says, hey, I went to Dr. Smith is charging me out of network, but your provider directory says he was in network. The participant gets insulated to the detriment of the plan. Next slide. Balanced billing disclosure, there's a new notice. Luckily, the notice does not have to be distributed in accordance with ERISA. So you really just need to pop it up on your benefits intranet. I'm going to talk about that a little bit more. The government has given us a model notice using, it's really to explain the surprise billing rules, which I'm getting to. Next slide. Continuity of care. This is another complex provision where if a provider or hospital or facility is in network with the plan and then moves to out of network, the participant receives the benefit of the transition for at least 90 days. So the plan will insulate the participant from out of network costs for at least 90 days after the transition. Next slide. So you're going to want to make sure your health plan is ready to administer that. Health benefit brokers and consultants need to disclose to plan sponsors any direct or indirect compensation received for referral of services. And the next one, this is a whopper. We just received guidance over Thanksgiving. The agencies actually hate me personally, I think, because they always issue just a mountain of guidance or pass a law, right? So they can go on holiday right before ours. So I'm going to talk about that very quickly. This is a big prescription drug provision. Next slide. I'm not going to spend too much time because we are very limited, but there's going to be a separate under Consolidated Appropriations Act data file that needs to be submitted to the government with respect to prescription drug costs. So the government wants to get to the bottom of why pharmacy is so high. And what it's going to do is this file is going to apply largely if you have a carved out pharmacy benefit manager, your PBM is going to need to help you. If it's carved in, it will be your health plan. But even if pharmacy is carved out, your medical plan TPA also has data it needs to submit. Who must report? Group health plans that are subject to ERISA, non-federal governmental health plans, church plans, individual health insurance coverage, student health insurance, and federal employees health benefits. Next slide. So the file is actually going to need to occur no later than December 27th, 2022. And the way it's going to work is that file will contain data for 2020 and 2021. So I have a client right now that is switching carriers. You're going to want, if you're switching carriers or health plan administrators, you're going to want to get in touch with them right away if they have your 2020 data or 2021 data, because that is going to need to be submitted. Right now, the guidance, which they're taking comment, the government is actually taking comment. Health reimbursement arrangements are excluded from the submission, accepted benefits, short-term limited duration insurance. Too soon to tell if there'll be additional exclusions. Then every year thereafter, by June 1st, you will need to submit. It doesn't matter what your plan year is. All of this data is on a calendar year plan year. So for example, in June 1 of 2023, 2022 data will need to be submitted. So I don't know if the TPAs are going to charge extra for this, but if you're self-insured, it applies to you. If you're insured, next slide, your insurer can take responsibility, but you need contract language, just like the ACA transparency provision. So very similar language, almost identical. Next slide. Okay, so the departments are going to be issuing additional instructions like files, where to submit the file, how that's going to work. So stay tuned. I'm not going to take you through all these provisions because I want to get to surprise billing. So if you could advance the slides, a couple slides, so you can read through this on your own. Note surprise medical billing. Okay, so in addition to all of the transparency rules, there have been a number of regulations issued following the Consolidated Appropriations Act. They call it the No Surprises Act. So basically the way it works is similar to Affordable Care Act, and that you really can't hurt somebody who has a true emergency and ends up at a not-a-network ER. You have to pay it comparable to in-network. But the big news, the big change was, let's say I go to an in-network hospital, and then the anesthesiologist shows up and he's out of network and I have this huge bill. You can't do that. That can't occur anymore. The only way it can occur is if you are provided a notice in advance and the participant actually signs off or is told ahead of time that I agree to have an out-of-network anesthesiologist. Beyond that, the plan is going to have to insulate the participant from these sort of out-of-network surprise bills. Next slide. It applies to grandfathered and non-grandfathered plans, non-federal governmental plans, and church plans. Next slide. Sorry, I know this is like speed. It's like a speed regulatory update, but there's a lot to cover. So there's a very specific methodology for determining what out-of-network providers are paid by the plan when a participant has a surprise medical bill. Generally, for most self-insured group health plans, they will use what is called the qualifying payment amount, which is generally the median of the contracted rates by the plan for the specific item or service in the geographic area. Next slide. So I just want to highlight that one of the most complex provisions of surprise billing is when people start, when all the parties start arguing about what they're required to pay under the law. I want this to come out the right way, but it is complicated. So at first, you can have maybe a physician or a facility arguing with the plan on what amount is actually due. They're going to have like this early process where they can kind of work through it. But if they can't work through it, then it goes to a federal independent dispute resolution process. And during that process, all of the parties pay $50 up front. It goes to this IDR, and then everybody gets it's almost like arbitration, where the party decides what actually gets paid. Next slide. And in that process, I'm just going to talk for a moment. The losing party ultimately has to pay the costs of the decision-making process. So it's going to be a fee on top of the $50. You're going to need your health plan administrators to organize and implement this process for you. But what I am seeing from a number of TPAs are additional fees. First, that $50 fee is right in the law, but then if the parties don't win, if one of the non-prevailing party is going to have to pay an even bigger fee to kind of work through what that ultimate payment comes through for the plan. So what you should be hearing from me during this very speedy legal update is make sure you're in contact with your health plan administrators and make sure you know what they are doing on your behalf and look at what the fees are. You also have some mandatory things to get in your contracts. And things like surprise billing are affecting your summary plan description for certain. My checklist at the end kind of helps with some of that to kind of walk through. Real quickly, here's the model notice you need to present to participants. Make sure it's up on your benefits website. Work with your health plan administrator on if there's any customizations to it, but just make sure it's up and ready to roll on January 1st, 2022 if you're a calendar year plan. Next slide. Illinois disclosure law. I am really a federal legal consultant because most of healthcare is ERISA, tax, or Public Health Services Act. But Illinois decided it was time to go rogue in the benefit space. So I just want everybody on this call to know about it. Next slide. So Illinois came out with this interesting disclosure law that said, hey, we want all employees in Illinois, and what they have said through email. It was my read of the law, but I checked with the state of Illinois, Department of Labor. If you have employees in Illinois, they want you to prepare this form where it compares the Illinois essential health benefits against your employer-sponsored group health plan. So even if you're self-insured, they are taking the position that ERISA does not preempt and that you need to complete this form and pop that up on your company's intranet and provide it to all new hires. So whether or not ERISA will ultimately preempt this state law, if you're self-insured, remains to be seen. There'll need to be litigation. There isn't that much work with it, so it might be worth your while just to fill it out. The state of Illinois understands and acknowledges that you employers who sponsor self-insured group health plans do not have to offer essential health benefits, of course, under the Affordable Care Act. Once you do, you can't impose any dollar limit on those EHBs. You have to designate a benchmark plan, and I don't want to go down that rabbit hole. If you're insured, you do have to offer the EHBs generally. So basically, it's just a notice form. Next slide. And that's their position. So they want all Illinois employees to have access to this form, and you might want to put the information then in your notices. So just say, here's where the form is located, and the penalties for noncompliance are there. Amelia, I'm just about done. Next slide. Okay, from here on out, I have included a checklist of recent changes over the last 12 to 18 months. So you can go through and say, did we do this? Did we do that? Do we need to amend our plans? Do we need to issue a SMM? And just make sure most federal items haven't been missed. So with that, thank you. I'll turn it back over to Amelia.
Perfect. Thank you so much, Lee, Pratik, and Molly. We do have time for shared Q&A with our speakers in the last few minutes of today. So if you guys have any questions, you can feel free to chat those to me directly. You can pop it in the chat. I'm trying my best to kind of monitor any questions that are coming in. I personally found these presentations really, really helpful. And one of the questions that kind of came to me initially was, last week, Leah mentioned the talent stuff that you discussed, because last week we actually did a panel with our tech council about whether you build or buy innovation, and the conversation turned to labor needed to build in-house, which quickly turned to whether you would see more mergers and acquisitions as there are talent shortages as companies go to purchase other companies essentially for the talent. Are you expecting to see that more? Is that anything you're hearing from your clients? Do you think that'll be a trend that happens in 2022? Oh, I think you're muted.
As usual, right? I need my mug that says you are muted. The board survey definitely did trend towards companies looking for opportunities in the merger and acquisition space for both of those reasons, whether they're looking for new revenue streams or just looking to expand. And as most of you are probably aware, it is more expensive to bring on outside talent. So there's also this investment in trying to retain the talent that they do have. So I think that those were the two key areas that you were interested in, and the survey does support.
Perfect. Another question, Pratik, is just you mentioned a little bit the small businesses, and we do have a few small businesses on the line. What would be kind of one key, because we covered a lot today. So what would be kind of like one key takeaway or something that they should watch in terms of tax policy into 2022 or in 2022?
Yeah, we're the one takeaway for small businesses or for the pass-through entities. Up until now, an active pass-through entity was subject to something called self-employment tax. With the new pending tax law changes, that might come to passive entities as well. So anyone that's a pass-through entity would be subject to self-employment tax, which sort of circumvents the need for an S selection, I guess. So that's just something to keep an eye on. It might end up being about a 5% increase in tax liability for small business owners.
Okay, very interesting. Does anyone else have any questions for our speakers? I did get a few pings. This is recorded and we will PDF the presentation and send that. That was a very common chat to me. And I think it was because there was so much wonderful information. So Molly, I know you covered a lot too. I would love for you to just be able to do kind of also something, a quick kind of takeaway for our attendees of something they should be monitoring.
Yeah.
We do have a lot of small and mid-sized businesses on the line as well today.
Okay, so when I know sometimes you don't have your own ERISA counsel, this might be one time just to kind of go through your plan documents, talk to your PT or your TPAs, go through the checklist and say, that's why I provided a checklist. This year has been like the Affordable Care Act, but we had years to implement the ACA. This year, they're still implementing the ACA. And by the way, here's just literally a tsunami of things you need to do. So if you were audited by the DOL, IRS, HHS, you just want to be ready. Go through those items. Many things are effective as of January 1st, 2022, on or after if you have a later starting plan year, and just make sure those things are being handled. It is on you as the plan sponsor, even if you're insured. So just make sure you're ready on those items.
Perfect.
Sorry, that's why I did a checklist at the end. This could have been,
that's perfect.
like Lee said, 2 or 3 hour discussion.
I know, and there's a lot of content to cover, and I saw we have a bunch of people from HR on as well. So I just want to say thank you guys so much for your time today. I want to say thank you to our attendees for hopping on right before a holiday. Jack or Jason, you guys are still online. Do you have anything to add before we close out?
No, I just want to thank everybody for joining today. I think we had a lot of great information. As Amelia said, we will have this recorded. This is recorded. It will be on our website. So you can go on and see that if you missed something. If you have any questions, certainly contacting any of our panelists or contacting Amelia to reach those people. But thank you again for joining us. Thank you to our panelists, Lee Sentnor of BDO, Pratik Patel of BMO Family Office, and Molly Icavoni of Aon. Thank you for being here and thank you for your great insights. Thank you, Amelia, for moderating the Q&A and all your great work here in 2021. And also thank you again to our sponsors, BDO, Jason Lipschultz, BMO Harris Bank. I know we had Steve Fansler on the line. Aon, we had JP Graziano and Vicky Tran who worked with us on our program. Thank all of you for your sponsorship and leadership and working with us on programming. And really all the best to everyone for a very happy holiday season and a healthy and prosperous 2022. We had some great insights here and look forward to a great 2022. So thank you all again for being with us today.
Thank you, everybody.
Thank you. Have a lovely day.